NGOs play a huge role in our healthcare system. So from Dr. Nkuli, from your perspective, impact of NHI, NGO space, and a hospital space, you've worked in the public hospital before, and the environment you find yourself in.
Can I make a comment?
Yes.
About an earlier point, which is a huge point of contention, and I see one doctor in the room, and she may agree with me. The issue of overtime.
Yes.
Good.
The issue of doctors' overtime and how you can save on doctors' overtime, I think it is a contentious issue in the public sector.
Okay.
We know that there are people who abuse overtime, but we also know that we need it. We don't have enough specialists to be able to cover the services that we require. Sure. Remember, we run 24-hour services.
Yes.
And most of our services, by and large, are carried by junior doctors, by medical registrars, who need to be supervised by specialists. Full stop. Without specialists in the private health sector, you can't do training, right?
Sure.
And so the issue should be, how do you optimize on the people that you have?
Sure.
So that's one, you know. And if there are people who are delinquents, there are delinquent people everywhere. You identify it and you deal with it.
Yes, yes.
You know, because I'm worried about us really looking at saving on overtime, because it does become a contentious issue.
Okay.
And one of the reasons why some of us supported NHI when it started is that when you're in the public sector as a doctor, we cannot compete with the private sector and the money that they make in the private. You cannot.
Even after the overtime?
Oh, no, you cannot. You know, especially for certain professions. 7 billion. You know, 7 billion for you, it's a lot, but when you're talking country level, it's not. No, the guys make money, and she would know how much they pay them at Discovery Health. So a cardiothoracic surgeon that I'm paying 2 million a year, let's say. At best, I'm paying them 2 million a year. They can make that 2 million in 3 months. She knows. So how do I then compete? And so the issue of overtime for us, it's a compensatory mechanism. We need it to support the young doctors. But the minute you start taking away some of those things from the public sector, you're crippling us even further from being able to retain the very scarce skills that we require. And so when you talk about NHI, then we're looking at, okay, what kind of reimbursement mechanism can assist us to ensure there's an equitable distribution of healthcare workers across the sector? You know, and so we've got private doctors, public health doctors who are also doing private work. That's what's currently happening because we are competing against each other on the regular, from nurses to doctors. Anyway, that was just an aside. Just to say.
I'm sure we're going to circle back to this.
We should.
It's a hot topic. So from an NGO, and maybe I'll separate myself from maybe a regular NGOs, because many NGOs operate at primary healthcare preventative level, right? And obviously you need them there to support from a community-based point of view, to stop people from coming into hospital services, which are much more expensive than primary. So, but we are an NGO that's operating at tertiary quaternary level. So we are unique, we are expensive, we are expensive. No, we are. And if you look even at the law, the legislation, the type of service we provide is low volume, high cost. It is by design. You know, when you start talking specialist services, which is where most of the private hospitals are operating in that very high cost type of service. And so, but what's unique about us is that we service both public and private patients under the same roof. And when I say we're a good model for the NHI, because to some extent that's what you're trying to achieve, where all of us are treated the same way, we have access to the same services, regardless of who's actually the funder. Because when you're at the coalface, when at your service delivery point of view, it doesn't matter who has funded the services. The services are meant to look the same. And that's what NHI is trying to do, for services to look the same. But we can debate upstream who's funding, how is it happening. And so that's why I'm saying it gives us an opportunity for a hospital like ours to be an example of a model that can be utilized, you know. But for us to be that, a lot had to be done. The infrastructure that you have at our hospital is world class. So the question then becomes, how do you make sure that every other public hospital facility is at the level where Nelson Mandela is, or Netcare is, or Life Healthcare is, which can be a bit problematic with the bill itself, because those are some of the requirements. But then how do you bring those people?
Okay.
In terms of the systems that we have invested from a billing point of view, we bill like a private hospital.
Sure.
In a public hospital, they don't bill like us.
Sure.
So we literally like a private hospital servicing public and private patients. But there's a lot that had to be put in there to make sure that we're operating at that level.